Hi, Sarah. My name is Rachel Ibarra, and I am an occupational therapist student. And today I will be going over your current medications that the doctor has prescribed for you, as well as go over a medication management plan that you can utilize in your own home. So I see here that the doctor has prescribed you to seek OT services for your obsessive compulsive disorder or OCD. So I just wanted to touch a little base. I know you probably already know what OCD consists of, but I just wanted to touch base on some of the symptoms and what OCD is. So OCD is considered an anxiety disorder and usually stems from some sort of fear or phobia that a person is feeling. Usually the person suffers from repetitive and obsessive thoughts, as well as obsessive impulses, and can appear to have repetitive behaviors and acts that are affecting their ability to complete their daily routines. So, that being said, I see here that your doctor has prescribed for you for your OCD fluoxetine once a day in the morning and alprazolam once a day at night before you go to bed. So, I would like to go through these two medications and discuss their purpose, their side effects, and the cost at your local pharmacies. The fluoxetine, or the generic version of Prozac, is a medication that helps with depression and helps improve a person's mood, energy levels, increase your motivation, your sleep, and your appetite, as well as it helps with panic attacks and your unwanted thoughts and obsessions you're having. It helps reduce those so that you can reduce your repetitive tasks. Some side effects that can be caused by this medication would initially be anxiety because when you start to take the medication, some patients feel an overwhelming amount of anxiety at the beginning, but as the medicine subsides in your body, the anxiety starts to go away. Some nausea, dizziness, drowsiness, sleep problems, appetite loss, possible sweating, and persistent yawning can occur. And if these symptoms or if these side effects were to get worse or become more extreme, I would definitely talk to your doctor to discuss possible medication changes or see what is going on. So the cost of the fluoxetine would is about $5 to $15 for 30 capsules of 20 milligrams, and this ranges between Walgreens, Publix, and CVS. But it ultimately does depend on your insurance and what they cover. Medicare does cover it, so it just depends on what you have. The other medication that you are taking, the alprazolam, which is the generic version of a Xanax, is used for depression as well. It works as an adjacent medication to the fluoxetine, and its purpose is mainly a calming effect on you and to help treat anxiety and panic disorders. So this helps relax you and can cause you to be tired, and this is the reason why your doctor prescribed this one at night to be taken before bed, because it could probably help you to sleep a little bit better. Some of the side effects, though, caused by this medication could be physical and psychological dependence on this drug, and this could turn into withdrawal syndrome, which can cause a rebound of anxiety, insomnia, diarrhea, and light sensitivity. So these are some things that you should watch out for. If you're feeling any of these, we should definitely speak to your doctor. Some other potential side effects with this medication would be definitely drowsiness, dizziness, your change in your sex drive and abilities, and your saliva production may increase. Again, if these medications or if these side effects are hindering your abilities to do things and feel that they've gotten to an extreme, you should definitely talk to your doctor. This medication is also partially covered by Medicare and costs between $10 and $15 at Walgreens, Publix, and CVS for about 60 tablets at zero point 0.5 milligrams. So it just depends on your medical insurance as well, and it just depends on your medical insurance. So now I'd like to discuss with you some precautions that you should be aware of while taking your medication. So if you decide you want to stop your medication, you should definitely talk to your doctor, because if you stop your medications, then your obsessive thoughts and feelings will come back. The reason you may feel you can stop your medication is because you're not feeling those symptoms anymore of OCD. So once you think that you don't have those symptoms, you think that you don't need to be on the medication anymore. But the medication is actually helping those symptoms stay dormant and stay inside, and not and so you don't feel those symptoms when you're on your medication. So stopping that medication would only make your symptoms come out more, and you would be back to where you ultimately started. But so definitely talk to your doctor if you feel that you want to change or stop your medication, so that you can do so appropriately. Also be aware of the treatment costs and the medication side effects and your body. And you definitely want to talk to your doctor about what you may be feeling, if you're feeling anything out of the ordinary, or if you're feeling an extreme of those side effects. And then lastly, another precaution would be don't mix these medications with any alcohol or other drugs, because this can be harmful for you and the safety of others. So now I would like to discuss with you your routines, your rituals and habits, your role as an individual, and the environments that you are usually in, so that we can address your intervention plan and mend them in with your routines. So I see here that your routines are in the morning would be to wake up, brush your teeth, take a shower, then you eat breakfast and drop your children off at school, and then head to work. Okay, and so then I also see here that your nighttime routine consists of cooking dinner for you and your family, putting your children to bed, attending to your grooming tasks such as brushing your teeth, using the restroom, and brushing your hair. And then you like to read a book before bed, and then ultimately you go to sleep. So that would be your nightly routine. So hopefully we can incorporate this intervention plan into these routines, so that your medication management can, so that you want to take your medications regularly. And so what would you say that your rituals and habits would be? I see here that you say you can constantly need to recheck your actions and thoughts, that you feel that you constantly need to recheck your steps to make sure that you have completed your task correctly. So, and then you also say here that because you have a fear of not getting the task done correctly, so you want to have a reassurance that the task was done right. So you continuously recheck your work, or check whatever task it is that you're doing, to make sure it was done correctly. That makes sense. Okay. So from that, I can see that this would be affecting your abilities to complete your daily tasks at home or at work, because you find yourself constantly rechecking yourself and rechecking what you've already done, so this stops you from completing the next task. Okay, so we will work on implementing your medication management plan into your daily habits and roles. So as a role as an individual, I see that you've put down that you're a wife and a mother of 2 children, and that you work as the manager of HR at a hospital. And your hours are about 9 to 5. Okay, so we will be able to incorporate the medication management plan for before you go into work and then before you go to bed. So it shouldn't hinder your time during your work schedule. Um, so what would you say that your environment consists of, your main environments? Okay, so it says here that it's mainly your home with your family and you like to go to work, or you have to go to work during the week, and then you like to go to an occasional book club with friends once a week for breakfast. All right, so that's great. We will try to incorporate this medical management plan um, so you can take your medication before you go to your book club. So now I would like to go into the actual intervention plan. So first off, I would like to suggest a daily schedule that's kept on your refrigerator to check off when medication has been taken. So we will start with the medication checklist that you will be checking every day for your AM fluoxetine and your PM alprazolam, and you'll be able to check in the morning when you've taken your first medication, and check in at night before you go to bed that you've taken it at night. So you'll be able to do this throughout the week and have this on your fridge so that you can check it off easily. So with that, then I would like to implement a pill box that starts with Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, and Saturday. And then within these pill boxes, I have separated it by AM at the top and PM at the bottom. So you'll be able to put your pill in the AM. You would take your medication and then take your pill box, put your fluoxetine in the morning, and then your alprazolam during the PM. And so every Sunday you will fill this up so that you can have the reassurance that this is already done, and then you can easily just go each day and take the medication that's needed. And then this will be placed on your bedside so that you have easy access to it before bed and when you wake up in the morning. So since you say that your morning routines are you wake up and then you brush your teeth and then you shower and you eat breakfast, I think utilizing this pill box and taking your AM fluoxetine in the morning right before you go to breakfast or you eat your breakfast, that then you'll be able to eat it with a full stomach of food, and then you can go over to your refrigerator and check off your medication that you've taken in the morning. And then at night, when you come home from work, after work, then you can make dinner with your family and put your children to bed, attend to your grooming tasks, and as you're reading, right before you're reading your book, you can take your medication that's on your bedside and take your PM pill, and then you can check it off right after you finish reading that you've taken your PM medication. And then each day you will be able to track and be reassured that you have completed the task instead of going back to take your medicine again because you're unsure if you've taken it. So this will give you a reassurance, and then looking at your pill box and seeing that it's empty because you've already taken it or it's filled because you still need to take it that day will help you know if you've completed the task of taking your medication correctly. Then I think utilizing your phone, which everyone has on them every day, setting an alarm on your phone for a little bit after breakfast so that you get a second reminder besides just the checklist on your refrigerator that in case you by chance miss over your refrigerator, you get a second reminder on your phone as an alarm clock stating that you need to take your medication in the morning. And then you can have one at night stating that you need to take it at night. So, and then now I'd like to discuss with you what we would do in an emergency situation. So that was the generalized intervention plan, keeping track on your refrigerator, using your pill box, and setting reminders on your phone will help for your generalized medication management plan. But then in an emergency situation, if you need to leave the house abruptly, then utilizing your pill box and taking it with you would be the best option. So taking it with you, it should be filled every week. So if you were to have an emergency situation on a Monday and you needed to leave the house, then you can easily have the rest of the week filled out, and all you need to do is check your pill box and take your pills correctly. And then also during an emergency situation, you should have this medication list tracker. This tracker allows you to put the medication that you're taking, the dosage that you need, the dates that you take your medication, the times that you take your medication, and the name of your doctor. This is useful in emergency situations. If you were to leave the house and say you could not grab your pill box, then you'd be able to take this handy dandy tracker out of your wallet and discuss with a doctor or a family member which medications you are needing and when you need to take these medications, so that nothing is forgotten. And then as another reminder in that emergency situation, you will have the reminder set on your phone, which will go off when you've left the house, and it will remind you of the times that you need to take it and give you the reminder to take it. And then lastly, I'd like to discuss with you an adaptive alternative that you can utilize in your home to help with your medication management. So this is called a pill drill, and it's about this big, and it looks just like an alarm clock, and it has different settings to it that allow you to do different things in reminding you for your medication. So you can take your medication and swipe the top of the alarm clock, and it makes sure that you're taking the correct medication and the correct dosage. It comes with a pill box that you can swipe over to make sure that is the correct medication that you're supposed to be taking at that time. And it also comes with a cube that has different feelings and emotions of the pictures of emotions around the cube that you can swipe each day to let the pill drill know what feelings you are feeling that day in coordination with your medication. So it will be able to keep track of what you're taking, when you're taking it, and how you're feeling when you're taking what medicine, which is great to help keep track of your medication. So this can be a little bit tricky for the non-technological savvy and can get a bit expensive. So for an individual that would want to make this device a bit easier, simplifying it would be able to use an alarm clock that just has the alarm set in the morning and the night for you to be able to know when to take your medication. And then you could use a journal to write down your feelings every time, like after every time you take your medication, so that you can have a general understanding of how you're feeling day to day while taking your medication, and keep track to make sure that you are still feeling good and that you're feeling in a safe environment while on your medication. So today we went over the 2 medications that your doctor has prescribed for you, the medication management plan that you will utilize throughout your day, and then a situation for a medical management plan for an emergency situation. And we also went over an adaptive alternative that you could use instead of your pill box and writing down your list. that is an adaptive technology, and a way to make that technology easier to use. So I hope this was helpful, and if you have any questions regarding your medication or your intervention plan, please don't hesitate to ask, and let your doctor know if you're feeling any additional side effects. Thank you very much. Again, my name is Rachel Ibarra. Thank you.